Greetings, I'm Amelia, and this presentation we're going to be examining herpes simplex virus. Herpes simplex virus actually refers to two highly related viruses called herpes simplex 1 and herpes simplex 2, or HSV1 and HSV2 for short. These two viruses cause two unique diseases, although there is some overlap as we will discuss. In general, HSV1 causes oral herpes, and HSV2 causes genital herpes. Infection with HSV1 is endemic throughout most of the world. A 2012 estimate held that some 3.7 billion people under the age of 50 were infected with HSV1. Most of these infections lead to oral herpes, although some cause genital herpes. Infection with HSV1 typically occurs during childhood, and the mode of transmission for HSV1 is oral to oral, as the virus is found in saliva, oral sores, and on surfaces in and near the oral cavity. Transmission can also be oral to genital in cases where infected persons engage in oral sex. The incubation period for infection ranges from 1 to 26 days. Most individuals who contract oral herpes are asymptomatic, and when symptoms do occur, the principal one is the development of blisters and ulcers in the mouth and on the surrounding facial structures. These sores are often called cold sores, and they can be quite painful, and they typically last from 1 to 8 days. Symptoms may occur in recurrent episodes throughout life once one is infected. When HSV1 causes genital herpes, it causes similar blisters and ulcers to form in the genital regions. Recurrence of symptoms is less likely to occur with genital HSV1 infection. HSV1 infection also has been found to cause other types of infection, including encephalitis and an eye infection called keratitis in individuals who are immunosuppressed. Treatment of HSV1 infection relies primarily on antiviral agents such as acyclovir. These agents are used to calm symptoms and reduce recurrences. However, treatment cannot actually cure HSV infection. Once one is infected, the person will bear the herpes virus for life. Preventative measures must be taken primarily by the infected person and include not having oral or oral genital contact with others during active infection when the virus is more contagious, and not sharing with others objects that may transfer saliva, including individuals with genital HSV1 should abstain from sexual activity while they're symptomatic. Infection with herpes simplex 2 is less prevalent than HSV1 infection, but is still very common. It was estimated in 2012 that 417 million individuals were infected with HSV2. Incidence tends to increase with age, although adolescents are the group that actually have the highest number of new cases. The virus is the primary cause of genital herpes, and it is transmitted sexually through intercourse and intimate contact. Genital herpes disproportionately affects women because the virus is more effectively transferred from men to women than vice versa. And the incubation period for HSV2 is generally 2 to 12 days. Like HSV1 infection, HSV2 genital herpes is frequently asymptomatic or gives only minor symptoms. As many as 80 to 90% of infected individuals do not know they are infected. Symptoms that do occur include blisters and ulcers in the genital and anal regions, similar to genital infection with HSV1. New HSV2 infection also has some systemic symptoms that include aches, fever, and enlarged lymph nodes. While HSV1 genital herpes does not frequently recur, recurrent outbreaks of HSV2 genital herpes are common. These recurrent outbreaks are generally less severe than the initial outbreak, and the outbreaks are sometimes preceded by tingling or pain in the hips, buttocks, and legs. HSV2 infection has some additional interesting complications, particularly as it relates to infection with human immunodeficiency virus, or HIV. Individuals with HSV2 have a threefold increased risk of contracting HIV, and co-infected individuals are also more likely to spread HIV to others. In the context of HIV-induced immunodeficiency, HSV2 also causes complications like pneumonitis and meningoencephalitis, hepatitis, and retinal damage. Again, like HSV1 infection, treatment for HSV2 infection generally includes antiretroviral medications such as acyclovir. Treatment is used to control recurrences but cannot actually cure herpes infection, which will endure for the life of the host. Preventative measures include not engaging in sexual contact during outbreaks, although HSV2 can actually be spread by contact with normal-appearing skin as well. Condom use is helpful, although areas not covered by the condom are not protected. Male circumcision also provides some protection for men. An interesting complication of both HSV1 and HSV2 genital herpes is neonatal herpes, which arises from the vertical transmission of the virus from mother to child during vaginal birth. Neonatal herpes generally occurs when the mother becomes infected with herpes during pregnancy, particularly late in pregnancy, and it does not usually occur if the woman has been infected with herpes prior to pregnancy. Neonatal herpes has a range of presentations, including abnormalities in the skin, eyes, and mouth, encephalitis, pneumonitis, hepatitis, and vascular disruption. Intrauterine passage of herpes virus has also been reported, but it's extremely rare, and when it does occur, it gives rise to skin, eye, and neurological abnormalities. As you may have guessed, the reservoir for HSV1 and HSV2 is the human body. HSV has been found to hide within neural tissues as well as in sites of infection within the body. Now that we've talked about herpes simplex disease, let's talk about a bit about the viruses themselves. Both HSV1 and HSV2 have linear double-stranded DNA genomes. HSV1 has about 80 genes, and HSV2 has 74 genes. Herpes viruses have an interesting structure comprised of 4 layers. The genome forms the first core layer and is surrounded by a capsid, the second layer. Surrounding the capsid is a protein layer known as the tegument. And finally, surrounding the tegument is an envelope comprised of a lipid bilayer that's decorated with glycoproteins. And this is a diagram showing the basic structure of the herpes simplex virus, with the genome surrounded by the capsid and tegument with the glycoprotein-studded envelope. So we've talked a lot about nasty things that HSV1 and HSV2 can do to infected persons, but herpes is not all bad. In fact, HSV1 was used for a recent and impressive medical advancement in the treatment of cancer. Virologists were able to genetically reprogram HSV1 to infect and replicate inside tumor cells, where it also produces a protein called granulocyte macrophage colony stimulating factor that promotes immune activity. These combined activities lead to tumor cell killing. The new virus, called Imlygic, was approved by the FDA in 2015 to treat melanoma. So this goes to show how some good bioengineering can be used to turn a troublesome virus into an impressive medical tool. That concludes this presentation on herpes simplex viruses. If anyone has any questions, I encourage you to contact me through Canvas, and I'd like to thank you very much for your attention.